If Articulate wasn't part of my day-to-day, I think I would cry. I'm Chelsea Bohnstedt. I'm the Associate Director of Professional Education at the American Diabetes Association. When we create online training, we mostly use Rise, but we do incorporate storyline elements just to add a little bit of interactivity. We also use the Review 360 function quite a bit when we go through review because all of our materials have to meet certain clinical standards, so we go through a pretty extensive review process, and Review 360 makes that a lot easier. It's a substantial part of our organization's purpose to have e-learning modules. A big offering that we have is our continuing medical education library, which is a library of free CME resources. It enables us to take an idea and really scale it quickly to global audiences and make sure that physicians, social workers, nurses, dietitians are following the most up-to-date guidance. So it really allows us to communicate and disseminate our messaging very broadly with very little boots on the ground. I think interactivity, like an actual real-world scenario, is really important for a course, especially when you're in a field like the medical field, because that's usually the biggest unpredictable element, is how a patient's going to respond to the care that you're suggesting or the experience that they're having. So really being able to give folks a safe place to fail or just to go through what those interactions might look like in practice and rehearse and really start to think about what that might look like for them in their actual practice, in their day-to-day responsibilities. I'm a social worker by trade, so I also oversee our mental health initiative, which is a huge part of diabetes management with diabetes distress. It's something that doesn't get talked about very much. So I've been using the Articulate suite to design a diabetes education module focused on mental health management. Being able to do that in Articulate allowed me to create these really complex case studies where a learner feels like they're progressing through an actual interaction with a patient and getting that real experiential learning versus just reading a paper about it. So it really allows it to be a more immersive experience and bring mental health to the forefront of diabetes care. It's a unique topic, and I feel like the complexity of it makes it really difficult for us to translate into an e-learning course. So really having the tools to be able to do that is critical to us being able to share that information with our audience. Articulate really has enabled me to take a team of varying experienced designers, people who maybe are just getting started in their design careers, who maybe are just getting started in Rise. It's a very intuitive tool. They are able to hit the ground running really quickly and build courses and work their way up to things that are more intricate, using storyline inserts or things of that nature to really enhance their courses. It's a very accessible, modern format that our learners respond really well to. And I think if we didn't have Articulate, I don't know what we would do. Probably go back to PowerPoint, and we're full circle. I would cry.